Hi, my name is Victoria, and this is week 2 of my shadowing experience at Franklin Square Hospital. The first thing I did was follow the nurses as the shift was changing to learn a little bit more about the patients and the medication they were taking and what their history was. After this, I walked along with a nurse while she assessed 2 of her patients. The first baby was relatively normal, but the second baby was only 2 days old, and its gestation was 26 weeks. This baby weighed only 1 pound and 14 ounces. Last week, what I thought was a respirator is actually called a CPAP. The CPAP regulates breathing and makes sure that the lungs are always open. It can sense if the baby is breathing or not, and if the baby is not breathing, then it'll puff air into the nose. This baby did have a CPAP, and when I helped give it a bath, I had to do the same thing as before. We took the CPAP off, and then there was this temporary CPAP that I would apply to the nose, and then when they needed to get the face washed off, I would take it off and keep doing that. This baby also had a heart murmur, which I had the ability to listen to. When babies are this young, they're unable to eat, so they have an OG tube which goes down their nose. This OG tube ends up in their stomach, and the way they know how far the tube has to go is they measure from the corner of the mouth to the ear and then down to the belly button. And whatever that measurement is how far down the tube should go. To make sure the end of the tube is in the stomach, what they do is before they put any formula in, they pump some air in, and you listen to the stomach and you hear a little sound, which is the air going in. If you don't hear that, then the tube's not in the right area and you can't put food in, because it would be really bad if it was in the lungs or something like that. There's 2 types of ways that formula can be given when it's going through the OG tube. The first way is gravitational. So the tube holding the formula before it enters the OG tube will be in a stand, and so gravitational. It allows the gravitation just to go through the tube. And then there's another way, which is more common, which is like a pump, I guess, where the tube is kind of like a syringe, and they put it at its side, and this machine regulates how much it has to go, and it'll just push the syringe so that a given amount of formula is given. So those are my highlights from my second week at Franklin Square.